Imagine this. You're at your workplace enjoying lunch with your coworkers when you glimpse and notice that your coworker Sue has a distressed look on her face and a petrified look in her eyes. She grabs her chest and within a matter of seconds collapses to the floor. Would you know how to calmly handle the event while your coworkers lose composure and become frozen with fear? Would you know the signs of a heart attack and realize that your coworker Sue needed cardiopulmonary resuscitation, otherwise known as CPR? My name is Stacy Bennett. As a registered nurse, I am required to be certified in professional rescuer CPR, and I have been certified for 24 years. Consequently, I'm also certified as an American Red Cross CPR instructor, which I obtained in 2012. In an emergency, it is not your job to provide medical treatment. However, you are expected to act in good faith to keep the patient alive until trained medical personnel arrives and takes over. Today, I want to explain to you the life-saving steps of performing cardiopulmonary resuscitation, CPR, surveying the scene, contacting emergency medical services, and initiating CPR. Let's begin with the first step of surveying the scene. According to the American Red Cross, the first step in an emergency is to survey the scene. The most important thing to remember in administering first aid and CPR is to make sure that you and the victim are safe. Do not put yourself or the victim in any more danger. If the scene is clear and it is safe to proceed, check the victim for consciousness. Call the victim's name, shake or tap the victim, and ask the victim if he or she is okay. Then call for help immediately. Request an automatic external defibrillator, otherwise known as an AED, if there is one available. According to the article, with CPR, 2 bystanders are better than 1. CPR alone cannot restart the heart when it stops, but it can keep the flow of blood and oxygen moving until medical help arrives. So along with performing CPR, bystanders need to immediately call for emergency help. Let's say that you surveyed the scene and found that the victim is unresponsive. Now turn your focus to the next step in the process, contacting emergency medical services. If the service is offered in your area, call 911. According to the article, Cardiopulmonary Resuscitation, First Aid, if you are untrained and have immediate access to a phone, call 911 before beginning CPR. If 911 is not offered in your area, call EMS, the hospital, or the police directly. To avoid confusion, choose one person to contact EMS. If there is no one available, you must call the emergency medical service yourself. Give them your name and address, the victim's name if known, and the condition and the aid being given. Always let the dispatcher hang up first. This is one way that you know that he or she has the information that they need and emergency medical services can be dispatched immediately. Now that we've covered surveying the scene and contacting emergency medical services, we return our focus to the final step in the process, initiating CPR. After calling for help, return to the victim and perform CPR. Position the victim. Move the victim into the correct position, trying to keep the victim's body as stable as possible. Make sure to protect the head and back in order to avoid any further injury to the backbone or spinal cord. Then position yourself next to the victim's shoulders and check the ABCs, otherwise known as airway, breathing, and circulation. Open the airway, check for breathing. If the person is unresponsive and not breathing, be prepared to restore circulation. First, open the airway. Take the hand that's closest to the victim's head and put it on his or her forehead. Next, take 2 fingers of the other hand and put it on the bony part of the victim's chin. Tilt the head back. This maneuver is called the head tilt chin lift. Next, checks for breathing. Look, listen, and feel for a breath. Watch the rise and fall of the chest. Be careful not to take longer than 10 seconds. If there is no breathing, give 2 rescue breaths immediately. Take the 2 fingers of the hand that's on the victim's head and pinch the nose shut. Then take your mouth and seal the victim's mouth, giving 2 full breaths. Remember, if available, it is always important to use personal protective equipment, such as gloves and the CPR barrier, while administering first aid and CPR. This vital practice prevents the transmission of disease. After giving 2 full breaths, immediately begin the process of circulation by initiating chest compressions and cycles of compressions and rescue breaths. According to the current guidelines of the American Red Cross, it is recommended that you do not take the time to locate the person's pulse to check for signs of circulation. Position your hands on the victim's chest. Locate the correct hand position by placing the heel of one hand on the victim's sternum, otherwise known as the breastbone, in the center of the victim's chest. Place your other hand directly on top of the first hand. Interlace the fingers, being careful not to place the fingers on the chest. While maintaining the correct hand position, straighten your arms and lock your elbows so that your shoulders are directly over your hands. As stated in the American Red Cross Participants Manual, your body position is important when giving chest compressions. While in this position, compress the chest at least 2 inches for an adult. Continue the cycle of breathing and compressions for a cycle of 4, 30 chest compressions to 2 breaths, at a rate of 100 compressions per minute. Count out loud or compress to the beat of the song, Staying Alive. Continue these cycles until the victim breathes again or until trained medical personnel arrive and can take over. Today I have explained to you the life-saving steps of performing cardiopulmonary resuscitation: CPR, surveying the scene, contacting emergency medical services, and initiating CPR. Now let's go back to the emergency I mentioned at the beginning of my speech. Because of your knowledge of the 3 steps in administering CPR, you can be the vital link in the cardiac chain of survival, and you can help save a life. Thank you.